X-raying the wrong patient. Imaging 412. Mildred Williams. Medical error definition. A medical error is a preventable adverse effect of care, whether or not it is evident or harmful to the patient. This might include inaccurate or incomplete diagnosis or treatment of a disease, injury, syndrome, behavior, infection, or other ailments. Types of medical errors that occur in radiology. Radiology is a procedure-based service. It is essential that the correct procedure be completed on the correct patient. To uphold such standards, in 2004, the Joint Commission enacted the Universal Protocol. This was designed to ensure that appropriate steps are followed to prevent wrong patient identity, wrong surgical site, and wrong scheduled procedure mishaps from occurring. The Pennsylvania Era Safety Report. In 2009, the Pennsylvania Patient Safety received reports of 652 events in radiology departments. The results were as follows. Wrong procedure or test, 50%. Wrong patient, 30%. Wrong side, 15%. Wrong site, 5%. The involved procedures were radiography, 45%, computed tomography scan, 18%, mammography, 15%, MRI, 6%, ultrasound, 5%, state of Pennsylvania. This report demonstrates that errors in identification of both patients and procedures occur in most areas of radiology services are needed to be addressed departmentally to achieve a elimination of these errors. Reasons for misidentification in the radiology department. Number 1, failure to confirm patient identity. Number 2, patients having duplicate names. Number 3, lack of communication. Number 4, distracted employees. Number 5, understaffing in high-demand working environments leading to overworked staff. The role of poor communication in misidentification of patients. Poor communication amongst patients and healthcare professionals is responsible for many preventable medical errors due to 1, passively not requiring patients to identify themselves by using two identifiers. Number 2, lack of communication in the work environment amongst medical professionals. Number 3, suboptimal use of department computers by selecting the wrong patient on the work list. And number 4, unfortunately, poor communication may ultimately lead to unnecessary radiation exposure to patients. A picture is worth 1,000 words. Properly identifying patients is the first step in safety within healthcare systems. Improper identification can result in treatment errors. As a result, many organizations are now having patients take a picture that will be uploaded into the patient's electronic medical record. Cohort research has shown implementing images into a patient's chart has reduced the amount of misidentification of patients with both technologists and radiologists. Tips to avoid miscommunication. Avoid using room numbers or bed numbers to confirm the identity of a patient. The patient you are looking for may have been transferred to a different location. Number 2, require patients to verbally respond to questions. Avoid head nods as a confirmation of identity. And number 3, patients often misunderstand the name called. Ask the patient to state their name rather than passively agreeing to the name that was read from the requisition. Opportunities to strengthen the gaps. Number 1, photos of patients should be uploaded into EMR. Number 2, enough staffing should be provided to meet the demand. Number 3, a two-patient identifier method should be implemented. Number 4, patient safety accountability should be enforced. And number 5, proper communication during the handoff of a patient from one provider to another. Organize strategies that mitigate preventable identification errors. Number 1, observe and enforce compliance of patient identification policies. Number 2, develop a campaign to promote patient awareness of identification protocols. Number 3, conform to the Joint Commission's acceptable identifiers. They are patient's name, birth date, medical record number, or patient-specific identifier, for example, telephone number. And number 4, provide ongoing training and assessment of staff competency in sustaining an error-free patient environment.